An adverse drug reaction is an unexpected and unwanted consequence of the medication that we are taking. Adverse drug reactions are more common in older people because they handle drugs less effectively. They're less able to metabolize, they're less able to excrete medication, and they're less able to compensate for minor side effects from medications, so that these minor side effects can become much more serious. They might fall over, they might become confused, they might develop pneumonia or have a heart attack as a result directly of the medications they're taking.
Thrive is actually a proactive, collaborative medication management service. It's not a dosing aid. And it's not about taking away your independence either. It's actually about working with you, with your carers, with your family, with your doctor, primarily your GP, but any other specialists that you might have actually looking after you. It's working with all of the team of people that are around you in health to try and make sure that we manage your medications together. The service is provided by clinical pharmacists who are specialised in geriatric medication management. We'll then sit down with you and we'll find out from you what you're worried about. We offer a DNA test. And what the DNA can allow us to do is find out if your medicines are safe for you. Sometimes DNA testing shows us that the drugs that you're taking are either causing side effects or actually not even working for you. And the other thing it can do as well is it can preempt problems. So we can actually look down the track and go, please don't give this person this medicine because actually it's not going to be any good for them. So once we've spoken to you and actually identified the concerns and any concerns that we might have, we create a plan. And what we then do is once we've created the plan, we go and speak to your GP and we talk to him and discuss with him the plan. And from that, we come up with some action points. Once we've got those action points sorted out, we'll then come back and have a chat with you and we'll talk to you about what's going to happen next. And it's an ongoing process, so it's not like we just come and see you once and then never come back again. We actually come and talk to you constantly. And then if there are any concerns, we're at least there and available to have that chat with you and to actually then speak to your doctor to make sure that at the end of the day, everything's going smoothly for you. The main benefit of Thrive really is to keep you living healthy in your own home for as long as possible.
The best thing about Ward Thrive has been having information and a blueprint of exactly what Dad needs with his medication, and no more trial and error, or less trial and error. Our pharmacist has said we're just going to slowly reduce some medications. There's some in particular that I'm looking forward to seeing being removed from my dad's medication list. I think we'll definitely see Dad come back to a bit more how he was, back to the old days a bit more. A couple of times we've been out and about, especially on Father's Day. That was awesome. So he came home, we had a full-blown lunch and went back to Dad's care in the afternoon, and he was in his chair, you know, participating in things with other family members for about 4 hours, which is huge for Dad, yeah. My dad's medication chart, I wouldn't know what half of those medications are. We have everything in our folder, we have everything online, but Chilla, our pharmacist, has been fantastic. If I've got any questions, I could just ring her, but yeah, definitely I have a better grip now where Dad's at, what he's on, and when they talk about medications that are going to be peeled back, it's great, you know. I understand what these long named medications are. So yeah, it's pretty good. Definitely feel more involved. I would recommend Thrive. The whole process has been great. The results so far are really good. I would have it myself for my own. Once I get Dad sorted, I'll probably look at doing it myself. So, you know, why not have that information available for my doctor if it's there?